Time this session arguing about whether it ought to be repealed or not, with the general purpose of the legislation being to expand coverage, a central part of it. It was fine to talk about expanding coverage, but if we have a shortage of providers today, and someone comes along and says, well, let's figure out how to take another 35 to 40 million people, and you can't come up with enough providers now, there are some real challenges in terms of getting it done. Now, there are a host of problems with respect to how we got into this issue, and let me outline what some of them are and what I've been working on to try to address them. Clearly, the providers that we need most in the state of Oregon are ones that offer primary care to patients. Unfortunately, the reimbursement system for Medicare has discriminated against primary care in Oregon. It has penalized our providers who are offering primary care to seniors and children and others for doing a good job. And I and the Oregon congressional delegation have finally got some daylight ahead of us in terms of getting that changed. There are now going to be a little bit of an increase in those reimbursements for primary care. But in 2 years, there's going to be an Institute of Medicine study which has to come along and change the overall reimbursement system, which ought to make it more attractive to get those primary care doctors because they would get reimbursed not on the basis of volume, just pouring on the services, but on the basis of the best possible outcomes. So to me, changing the reimbursement system is one very significant part of it. I think there are others. Certainly a lot of physicians are concerned about malpractice, issues. They feel that the prospect of being sued is a deterrent. They're going into medicine, and so I continue to be of the view, it's in my health reform bill, that we need to have malpractice reform as part of an effort to fix American health care. My basic approach has been to ensure that at least there is some tier of protection for physicians who act in line with what are called practice guidelines. I'm sure you know more about them than I, but the idea is to protect physicians who behave reasonably given what their profession has outlined. A third area that I think has to change to get more physicians into medicine is what is commonly called the hassle factor. Is so many physicians just think they're being weighted down with bureaucracy and red tape. They say, why am I going to medical school for all these years to learn how to be a doctor, and then all of a sudden I have to, in effect, be put through bureaucratic water torture just to run my office and to get paid. So a big part of what I and others are trying to do is get rid of some of that hassle factor. The best way to do it is to have uniform billing. We ought to have one billing system so that you do not have to have physicians all across Oregon have to wrestle with scores of different systems that chew up time and money. So take those three.